Ladies and gentlemen, I would like to first thank very much for the organizers, ISSA, Mr. Konkoleski, and ISSA Construction Sector, Mr. Robert. I think the choice taking aging and globalization as the topic for today is extremely welcome. We know that globalization and aging will change the whole world, and therefore we should be well prepared for that. I would like to report of following topics. First, about some features of the aging and labor market. Secondly, aging and workability, a new model developed for research, for prevention, and for praxis. Then about some features of the accidents and age, and also sickness absence. And then a few results of the Finnish Occupational Health Survey concerning construction industry. Then the next topics will be dealing more to the prevention action side, how to promote the workability of construction workers, and what's the role of age management coaching. And finally, as a summary, some challenges of aging of the workforce in the future. So I think it's very well known that all the societies are getting older, and therefore also the workforce is getting older. You can see from here, from this slide, that from 2005 and 2010 in European Union member states, these two groups are growing. The younger age groups are declining. So we will have some 5 million more people, for example, in that group 55-64. And when we look now the next period from 2010-2030, you can see only one age group is growing. All others are declining. And the group growing is that 55-64, some 15%, meaning only in the European Union member states, some 9 million more people in that age group. So this is the curve showing how the difference from the oldest and youngest cohorts in work life is changing. So the upper curve is expressing the situation proportion of the 50+ population at work, and the lower curve is that of the youngsters. You can see that the nice balance we had still in 1985 has disappeared. And we can say that about in 2025, we do have double so much older worker in a workforce compared to the younger one. So, ladies and gentlemen, we do have these 5 generations in our society, and 3 of them should be in the working life. Therefore, we talk about the dependency ratio 3:2. 3 generations inside the workforce and 2 outside. So that's the way to finance the best possible education of the youngsters, and also a security for the oldest, that they can enjoy life, as you can see from the picture. So the problem here is that this 3:2 rate doesn't work anymore because of 3 reasons. The first reason is that this younger generation is integrating much too late in work life. We are estimating that the delay is something 2 to 3 years even in Europe. And in the middle age group, these work careers are not anymore very solid as they were before. They are longer sick leave periods, they are unemployed periods, and the restructuring of the working life push people out also quite easily nowadays. And the oldest generation is leaving the workforce much too early. So altogether, we are losing some 5 to 6 productive years per person in Europe. And that's much too much. So therefore, if we are taking the aging challenge in a correct way, we should have the life course approach, having look of all generations, because otherwise we cannot extend the work life. If we only push the oldest to work longer, it's not a solution. We have to find solution also to other generations. So then few words about the aging and workability, but perhaps first the basic problem and basic solution. So when we are growing older, it's very normal biological process that some of our functional capacities decline, especially the physical functional capacity dealing with musculoskeletal or cardiovascular capacities. At the same time, however, our work demands doesn't change at all. They are namely not age dependent. Therefore, the possibilities to work are getting harder when we are growing older in physical demanding jobs. Our reserves should be big enough for the recovery, and now it is not the case. Therefore, many people in physical demanding jobs will get a lot of problems handling their jobs. They might do it, but they do it with overload, and then they will get some work-related diseases because of that overload. So the basic solution will be shown here in the right-hand panel. So we should keep in our mind that we can have an effect on the aging process. So the decline has to look like that. That's very premature decline. So that would be normal aging process, keeping our capacities in appropriate level. But at the same time, we should also decrease the workload so that the reserves, what we have when we are at the age of 30 and age of 60, are about the same. This is the new democracy in working life, a model for that. But the problem is that we might be able to do that easily, more easily, but making that line in a correct way, reducing the workload, age-related, is much more difficult.